Hello and welcome to another extremely noisy day outside the new Royal Liverpool Hospital. As you can see, there's a massive picket line behind me. This is the biggest picket line we have covered so far. This is a unison picket line which involves loads of staff from in that building there, the new Royal Liverpool Hospital. We've got nurses who are covered by unison. We've got support staff, healthcare assistants, admin staff. It's an absolutely massive turnout. As you can see, it goes from down there all the way to the top there, and this isn't the only one. There is actually another picket round the other side. We've obviously had 2 days of Royal College of Nursing strikes. This is Unison's turn. These people have had enough as well, and as you can hear from behind me, once again they're getting a huge amount of support from the people of Liverpool. So I'm here with Sarah Gorton, who is Head of Health for Unison, at this, let's be fair, very lively and very, very well populated picket line outside the new Royal Liverpool Hospital. As I've shown from previous videos, the picket line goes all the way up there, and then there's another one on the other side. So who's out on strike today?
So what you see behind is a mixture of the whole health team. So we've got staff from the support services, so healthcare assistants, we've got administrators, receptionists, theatre porters, all the way through all of the different clinical grades, occupational therapists, nurses, ODPs. It's the whole health team who are out today.
And they've all had enough, basically, haven't they? They've had enough of the working conditions they're being forced to work in, the pay levels, and is it also the lack of people being able to be recruited into the hospitals?
So the dispute is about pay and staffing. And, you know, put very short, the pay is making people leave the jobs in the NHS that they love for better paid and less stressful work elsewhere. The pay might not be such an issue if it weren't for the absolute short staffing that everybody's experiencing. We've got 133,000 vacancies in the NHS. So every single team in this building is short of staff. And every group of workers experience a day where they've not got enough people to do the jobs that they're supposed to do. And these are responsible jobs. People care about them, and patients deserve better.
I was going to say, what does that mean? You know, we spoke to a nurse yesterday who said that she was told that every single ward did not have a safe level of staffing. This is dangerous stuff, isn't it?
It is, and there is, you know, there is avoidable harm happening on a daily basis in the NHS. Staff who we've been talking to today have just been talking about the daily compromises that they have to make, and they go home at the end of each shift knowing they've not done what they wanted to do for their patients, and they've also not been able to look after themselves. You know, so people have been talking for years about the fact that their shifts are getting longer, their breaks are getting shorter, and more people are suffering the consequences and just deciding that they've had enough and have to leave. And the people here are making a conscious choice to not to give up and leave, but to stand up and fight for their jobs and the services they care about. Yeah.
Now you're a negotiator. You will have dealings with the government. What's been your response to, you know, we've heard Steve Barclay today saying that people should avoid doing things that might get them injured rather than getting around the table. Are you surprised? Are you saddened by the lack of willingness to negotiate from the government?
There's been absolutely no movement from the government. They've refused to talk to us. So, this time last year, we started asking them to work with us to put in a package of measures that would stop people leaving for better paid and less stressful work elsewhere. And they point blank refused. They just haven't even bothered engaging with us. And to come out, and wait until the week of a strike to really start talking to the public and talking about the staffing in the NHS is frankly just too little too late. These people have had enough. We've got the skills to work with them. We know what can make a difference. We know that a decent pay rise and a package of other measures could help to provide the conditions to stop more people leaving and start to turn the tide on the staffing crisis we've got. But until the government decide that they need our skills and that they can, they are prepared to work with us, it's really disheartening seeing their attitude.
Just finally, obviously these strikes could go on if the government is digging its heels in. Do you see, whether it's the RCN, whether it's GMB, yourselves, do you see this going on into the new year, and are you hopeful that the public will continue to support you through that?
So you can't run a health service without people, and we haven't got enough of those people. And at some point, the penny is going to drop with the Cabinet that they've made promises to the public about the health service that they'll be provided, and they can't do that without people. So they are going to wake up and realise that they need to work with us, and the sooner they do that, the better. And the sooner we can resolve this dispute and start working together to put staffing in the NHS right.